In this section, we will discuss about children presenting with suspected abuse and those presenting with aggressive behavior. In this section, we will talk about recognizing child abuse and the management of child abuse. Please refer to the National Guidelines on Child Abuse and Neglect for further information. Common physical indicators of physical abuse include multiple injuries at different stages of healing, unusual skeletal fractures, bite marks, or burn marks. In addition, physical abuse should also be suspected if the parent's account of the injury is not consistent with the injury pattern. Parents change their account of how the injury occurred from time to time, where parents delayed seeking treatment for an injury, or when the parents are in a rush to leave the hospital before the injury is fully treated. Sexual abuse should be suspected in cases where foreign bodies have been present in the vagina, where there are multiple anal fissures, and where there are skin lesions in the perineum. Certain behaviors displayed by the child should also alert the possibility of abuse. If the child appears depressed or fearful, is withdrawn, or displays sexualized behaviors, these also suggest a possibility of child abuse. Management of child abuse requires multi-sectoral collaboration. It should involve health, legal, and social services. In your first encounter with a child with suspected abuse, indicate that you're willing to listen and help. Listen to their concerns and gently communicate the suspicion of abuse and the need to protect from further abuse. However, do not force the child to talk about the details of the abuse, as it can be traumatic to the child. The child should be admitted if you feel that there is a risk of further abuse or that the child is not safe at home. Admission is also indicated where medical, surgical, or psychological treatment cannot be provided as an outpatient. For example, if the child is severely depressed or has a high risk of suicide, which cannot be managed as an outpatient, they should be admitted to hospital. All admissions should be to the pediatric ward. If you are a medical officer at the OPD, you should ensure that child's privacy is maintained. A brief history should be taken by the guardian. Do not ask the child about the details of the abuse, as it can cause re traumatization and worsen the psychological outcome. As the medical officer of the OPD, your role is to identify possible abuse, arrange for treatment in a safe and secure environment without any further risk of abuse. If the parents refuse admission, the judicial medical officer should be informed. Now we will move on to aggression in adolescence. In this section, we will discuss the causes of aggression in adolescence, their assessment and management. Causes for aggression in adolescence are varied. If the aggression was recent onset in a child who has no past history of similar behavior, it may be due to an underlying psychiatric illness such as depression, mania, or psychosis. Recent onset aggression may also be due to an underlying medical illness such as seizures or encephalitis. Substance use should also be considered as a possible cause for recent onset aggression in adolescents. If adolescent has a long history of aggression, that is, if he or she has been behaving aggressively since childhood, it may be due to conduct disorder. This was previously discussed. Environmental factors may also contribute to long-term aggression. The child may behave aggressively by imitating adults in the environment, Or else the parents may be unknowingly reinforcing the child's aggression by giving in to their demands when they behave aggressively. This will make the child learn that he can get what he wants by behaving aggressively. Aggression can also indicate underlying parent child relationship problems. The assessment of an adolescent presenting with aggression requires a detailed history. Features suggestive of underlying psychiatric disorders such as depression, mania, or psychosis should be looked for. Past history of any psychiatric disorders and possible substance use should be asked. The degree of aggression should be assessed. For example, does the child become violent and assault people or destroy property when he is aggressive? Has his aggression resulted in any person sustaining injuries? How the parents react when he behaves aggressively should also be found out. A risk assessment should be done to identify the risk of harm to others as a result of the adolescent's aggression. If the adolescent is aggressive at the time he presents to you, try verbal de escalation. Provide a calming, non stimulating environment. Avoid arguing or confrontations. If you're unable to calm him down, and your assessment suggests that he is at risk of harming the staff or others, use oral medications such as olanzapine 5 to 10 milligram or lorazepam 1 to 2 milligram and immediately transfer to mental health services. Aggression can lead to significant harm to the adolescent or others. Therefore, aggressive behavior, whether recent onset or long term, requires specialist assessment and management. Therefore, all adolescents presenting with aggression should be referred to mental health services.